Hi, I'm Dr. Nima at EOS Rejuvenation in beautiful Beverly Hills. Today I wanted to talk about the eyes. The eyes are such a unique element of the face. They can be fun, they can be flirty, they really show your emotions. Also, and unfortunately, it's also the first signs of where we show some aging. There are usually two issues when it comes to the eyes. The first one are under eye hollows, or more frequently seen as dark circles under the eyes. And the second issue are eye bags. And the eye bags can make you look tired even though you've had a lot of rest overnight, and it's just kind of a chronic thing that usually happens with genetics. Let's talk about eye hollows first. So eye hollows can happen and cause a little sunken appearance underneath the eyes. This causes the dark circles because there isn't as much light reflecting when there's a hollowness underneath the face. Frequently people use concealer to try to hide those under eye dark circles, but we have something even better for that treatment. The treatment for under eye hollows is essentially a little bit of filler, and what I like to use more often is something like Voluma or Velour that can be placed underneath the eyes and typically lasts anywhere from 18 to 24 months. I love that filler because it's nice and smooth, it doesn't attract any water, and lasts the longest. I use a specialized technique using a microcannula. The microcannula is something that gently slides underneath the skin and places the filler beautifully, and I can blend it in nicely for a very natural look. The best part about using cannulas is that you won't bruise afterwards, and that means you can go about your normal life and even go out later that night still looking great. Most of my clients who come in, I kind of encourage them that they don't really have downtime, they have uptime, because they really enjoy the swelling underneath their eyes because it gives them just a little bit more cheek. Back in the day when we used to use needles for injection, it was 2 weeks of downtime, which is just, essentially not tolerable in a place like LA or Beverly Hills. So we don't use needles when we do the under eye injections, and just cannulas so you go back to your life as quickly as possible. The second thing I want to talk about are under eye bags. Under eye bags happen a lot, especially in the Middle Eastern population or just anybody who's predisposed to it genetically. These, as you can see, are just bags that go underneath the eyes, and they can cause a little bit of dark circling, but essentially they just make you look tired. When it comes to under eye bags, there are also two treatments. One is surgical and one is non-surgical. The non-surgical treatment we've already talked about is very similar to the under eye hollows. Essentially, I inject a little bit of filler underneath the eye bags, and it helps blend with the cheek a little bit more smoothly. The surgical option is also a fantastic option. I love the surgical option because it creates a permanent result and you don't have to get fillers on a regular basis. With surgery, I use a specialized technique where I go from inside the eyelid, where you don't see your scar or incision, and remove the little pockets of fat. And typically there are 3 pockets of fat for each person. When I'm done with that, if we just leave it alone, you just end up with under eye hollows, which leads you back to problem number 1 that we discussed. So what I'll do is I'll take a little bit of fat from somewhere else in the body and essentially do a fat transfer just underneath the eyes and the outer cheeks and sculpt a beautiful cheek and lower eyelid cheek junction. The fat is essentially permanent, lasts anywhere from 5, 10, sometimes 15 years, and essentially reverses the clock like when you were younger. The downtime is a little bit more substantial than it is for filler. It's usually about 1 to 2 weeks of some mild bruising and swelling, but there really is no pain associated with it. Afterwards, you can go back to your life and people will just say that you look refreshed and that you had a good night's rest, but they'll really never know what you had done. So if you have any questions about your lower eyelids, please come and see us and I'd be happy to discuss them with you.